Hi, my name is Brennan Spiegel. I am the co-editor-in-chief of the American Journal of Gastroenterology. I'm on the board of the American College of Gastroenterology, and I'm a practicing physician, I'm a gastroenterologist, and I'm a professor of medicine and public health at Cedars-Sinai and at UCLA. So what I want to do here is briefly share some of what we're learning about how COVID-19 can affect the intestinal system, the gastrointestinal tract. I'll start by saying that this is not a substitute for medical advice. If you have any questions about your own condition or symptoms, by all means speak with your physician. And also know that this data is constantly updating. So what I'm going to share is what I know as of right now, based upon what I've been learning, what I've published myself, and as the editor of the American Journal of Gastroenterology, what I've been reading as the data comes in. So we know, of course, that COVID-19 is principally a respiratory illness. It can get in through the nose, get in through the mouth, maybe even through the eyes, but it gets into the airway and can get down into the lungs. And we've been appropriately focused on the respiratory symptoms that patients develop. And that's because that's what leads people to seek care. They come in with shortness of breath, cough, pneumonia, and in some cases need hospital care. But what we've also been learning is it seems that many of those people, when they come into the hospital, also have digestive symptoms like diarrhea, nausea, vomiting, a low appetite, which isn't very specific, low appetite, but diarrhea really suggests something's happening in the intestinal system. And we're also starting to learn that there may be, it seems, another group of people who develop those symptoms initially, even well before they develop a cough or shortness of breath or chest tightness. And in some cases, albeit rarely, there are people, it seems, that just have digestive symptoms and never develop respiratory symptoms. So I want to talk about that today. And what I want to start with is it's really important to understand that digestive symptoms are common just in everyday life. It's not unusual for people to have bloating, stomach aches, diarrhea. So just because you have these symptoms does not mean that you have COVID-19. I'd be lying if I didn't say I've been sitting around from time to time wondering, wow, the symptoms I'm feeling right now, could that be a sign of infection? So I think we're all very hyper vigilant, understandably, about our own bodies right now. And I just want to emphasize that stress itself can affect the body in many different and important ways. Stress can cause diarrhea. Stress can cause abdominal pain. Stress can cause headaches. It can cause chest discomfort, rapid heart rate, a feeling of jitteriness. And it's easy to think that, wow, those symptoms could mean I'm infected, but it could also mean that you're under a great deal of stress and anxiety, understandably, right now. So I just want to put that out and think about that. One thing stress does not cause is fever. So having diarrhea and fever, that's different. That's probably not just stress. But again, it's important that you always speak with your doctor. So I'll touch on some of these things. Now, one thing we know is that the way that this virus enters the body, some of you may have heard of this, is through this receptor called the ACE2 receptor. And that is a receptor that is expressed or found in different parts of the body. It's certainly found in the respiratory system. It's found in the kidneys. And it's very much found in the intestinal system. In fact, there's some evidence that it's expressed or found at a much higher level in the intestinal system than it even is in the respiratory system. And the way this virus enters the body is it latches on to that receptor, and then it gains entrance into certain cells that line the respiratory system or that line the intestinal system. And again, it's found in other parts of the body too. So that's important because if you get this virus, let's say in your saliva, and there is some evidence that it can invade, it can shed into the saliva. In some cases, it may even be found in the salivary glands. And from there, it can kind of go in two directions. It can go down the lungs if it goes down the respiratory system, or if you aspirate a little bit at night, for example, or don't cough well, or it can be swallowed and then go down into the stomach. When it hits the stomach, of course, we have acid in our stomach, and that's there for a reason. Acid can really kill pathogens. What we don't know, at least what I don't know yet, is just how much acid affects the COVID-19. And it's possible that it can significantly diminish the activity of COVID-19. I'm not sure yet either way. One thing that I do have some question about is whether people who take strong anti-acid medicines for acid reflux, for example, could that lower the barrier for this virus to get through into the intestines? I do not know that, and I have not seen research on that yet. So if you happen to have acid reflux and you're taking those medicines, I would always speak with your doctor about whether it's at all appropriate to reduce that. I would only say that we do not know at this point whether or not taking those medicines causes any risk for this particular virus. But the virus, if it makes it through that acid layer, we now know can enter the cells that line the intestinal system. And we're now seeing reports of it causing inflammation in various parts of the GI tract. The stomach can be involved. The small intestine can be involved. The colon can be involved. And we now have published in our own journal case reports, in particular of significant colitis, where a patient had diarrhea and had inflammation of their colon, but did not initially have a cough, did not have shortness of breath, did not even have a fever, and went into the hospital and was ended up testing for COVID-19 after developing a cough a few days after being hospitalized. Now, that is a case report that we have published from a hospital in Michigan. And in my Twitter feed, you can see links to that. I'm happy to provide links to that if anyone has questions. So that's an example of one way that it affects the GI system. It also seems that it can affect the liver. Now, usually what we're seeing is the liver tests can be elevated, and not in a dangerous way, but there is another case report that we published in our journal from Long Island, where doctors there saw a patient that came to the hospital with dark urine. And that could mean different things, dark urine, but it also can mean that the liver is affected. And this patient, again, did not have fever, did not have cough, did not have shortness of breath, but had evidence of significant and quite severe hepatitis or inflammation of the liver. And that patient was admitted and was treated for acute viral hepatitis, but later, after a couple days, once again developed a cough. And a chest x-ray then showed signs of possible COVID-19. And only then was tested and was found to be positive for coronavirus, or the novel coronavirus. So what these mean is, firstly, for people in the hospital setting, we need to be very vigilant for other ways that COVID could present. Somebody coming in with new onset diarrhea and a fever in particular, somebody coming in with what looks like viral hepatitis or gastritis. These might be, in some cases, right now, evidence of COVID-19. Now, there's another paper that came out of Wuhan, China, that was published again in our journal, the American Journal of Gastroenterology, that looked at people who were admitted to the hospital, 3 different hospitals in Wuhan. And what they reported was just over half of them, 50.5%, ended up having one or more digestive symptoms at the time that they presented for care. And what they called a digestive symptom was diarrhea, nausea, vomiting, abdominal pain, and low appetite. Now, again, low appetite is not very specific to the gastrointestinal tract. It's rather common, vague symptom. But when they just honed in on diarrhea, they found that just around 20%, a little less than 20%, or 1 in 5 of these patients ended up having diarrhea as one of their key symptoms. And they also have now done some research looking at the stool of people with diarrhea, and have found that first of all, over 50% of COVID overall, whether or not there's diarrhea, just over 50%. In one study, it was 53% had evidence of COVID-19 in the stool. Now, I'll talk about this in a second. That does not mean for sure that it's spreading through stool. But the genetic material, the RNA of this virus, is found in the stool in just over 50% of cases. Now, in those who have diarrhea in particular, in a paper that I was a co-author on with academic colleagues in Wuhan, we found that around 70%, about 73% had evidence in the stool versus a much lower percent, 14% of those with just respiratory symptoms, but no diarrhea, no digestive symptoms, had evidence of the virus in the stool. So what this means is that the virus is more commonly found in the stool in people who have gastrointestinal symptoms than in those who don't. Moreover, the researchers in Wuhan found that when people did have digestive symptoms, they tended to have more significant abnormalities in their labs. They didn't die at a higher rate, thankfully, but they did have a higher problem with their liver, or more problems with their liver, higher liver function tests, or rather liver tests, and they had a little bit longer coagulation of the blood in one particular study. So that's evidence that when two organ systems are involved, the lungs and the intestinal tract, there may be a little bit of a longer duration and possibly a more severe illness. But we need to learn more about that. Now, what do we know, though, about sort of less severe patients? Because a lot of the research has been focused on hospitalized patients, but in people who are out in the community, like right now, having diarrhea, and they're wondering, could that mean I have COVID-19? So I kind of talked about that earlier, but what we've learned is that yes, it can definitely present with diarrhea. There's no question about it at this point. And when it occurs, it lasts on average for about 5 days. And there are on average about 4 bowel movements per day based upon the data so far. So what's good about that, it's not good, but what's good about that is it's not like cholera. Cholera is a voluminous diarrhea, high volume diarrhea, where people can get really dehydrated, sick, and have electrolyte abnormalities and even die from that type of diarrhea. It seems so far that COVID does not cause that kind of diarrhea. It causes a lower volume, less dangerous type of diarrhea than something like cholera, but it definitely can present with diarrhea. And I have actually heard of one case report so far of this higher volume type of diarrhea. So we need to keep our eyes peeled for that. On average, it lasts between 1 and 14 days. So it can last a while. And some people have wondered, I'm 10 days into this, I'm still having diarrhea. Is that normal? From the data, it lasts a range in 1 to 14 days. Now, I mentioned that it can be found in the stool as well. And it looks like the virus can shed in the stool for weeks, maybe even up to 5 weeks after respiratory symptoms have cleared. And on average, about 11 days after respiratory cultures have cleared. So even after there's no longer signs of COVID in the sputum or the throat, for up to about 11 days on average, sometimes longer, sometimes shorter, there can still be COVID-19 in the stool. Now, the big question is, does that mean this is like an infectious diarrhea? And we do not, at least I do not know the answer definitively to that yet. I don't think anyone does. Now, there has been one small study that is out of Munich, Germany, that was published in Nature just the very first week of April. That was a very meticulous study of 9 people. So the first thing is it's a study of 9 people, and that needs to be taken into consideration. But what they did in this study is they looked to see, can they find evidence of a live virus, not just evidence that viral particles are in the stool, but is there a live virus? And it's very hard to do that research, but in the best of their ability, they were not able to find live virus in the stool of those 9 people. That's reassuring to a point. reason I say to a point is because those patients, and they say this in their study, did not have digestive symptoms, with the exception of one of the 9 who, as I recall, they said had sort of intermittent loose stools. But the others did not have diarrhea. They did not have colitis or inflammation of their colon. They weren't presenting principally with digestive symptoms. They didn't really have severe disease. So my question is, okay, I can understand if you swallow some of the virus that it might work its way all the way through your system and come out dead on the other side. But if you have active inflammation and replication of this virus in your intestine, could it be passing out alive? And we don't know that yet. We need to repeat a study like that in people who have digestive symptoms, have active diarrhea. And my colleagues who are real experts in virology and the microbiome, or the bacteria and viruses that live in our intestine, they have said to me they are not yet convinced on the basis of that study that we can rule out that this passes through the stool. So, what does that mean from a public health standpoint? Well, I think we should continue to do what we do anyway, which is social distancing, which is meticulously cleaning our hands. But also with toileting, it's as important as ever to be careful when you use the toilet. In other words, clean the rim, clean the handle. After you reach for toilet paper, don't immediately clean yourself and then wipe your face, right? That seems obvious. Or touch your face. Clean your hands before any of that has occurred. Close the toilet lid before you flush the toilet. Why? Because there's a long-standing theory that by flushing the toilet, small fecal material, small particulates or bioaerosols can go up into the air like a plume and potentially float in the air for some period of time, although it seems not for long. From the epidemiologists I've spoken to, have really reassured me that these are heavy viral particles, and they tend to settle down fairly quickly. So they shouldn't be floating around in the air for long periods of time in a bathroom. But still, if you share a bathroom with other people and you're suddenly having diarrhea and fever, yeah, you need to be careful. Maybe use, at the very least, different rolls of toilet paper, clean down the seat, clean down the handle. And this seems like generally good advice anyway. Now, if you are developing diarrhea, as I said, talk to your doctor. Diarrhea plus fever should always be considered possible infectious diarrhea. And, you should isolate yourself from other people, contact your doctor. I think that's generally, good advice, regardless of whether we're in a COVID pandemic or not. Now, the only caveat to this is I wish I can say that everyone with COVID diarrhea has a fever, because that would help confirm or distinguish whether this is potentially infectious or not, but it's not quite true. We found that about 3/4, about 75% of people who have diarrhea with COVID have a fever. So that means not 100%. If you have a fever and you have diarrhea, as I said, you should talk to your doctor. And you should always talk to your doctor, regardless of whether you have questions. But as I said, some people can have a lot of stress and anxiety, and that causes loose stools, that causes abdominal pain, does not cause fever. But if you have any questions about whether you could have it, and we've been told this from the CDC, we should all assume that we have COVID-19 during this time and take every precaution we can during this time to keep our hands clean, to be careful with toileting, to keep social distancing. So I hope this is helpful just to learn more about COVID-19 and the gut. We have a hashtag that we've put out, not just cough. COVID-19 is not just cough. It is other things too. It can affect the entire gastrointestinal system. We've seen it in saliva. We've seen it cause esophagitis. We've seen it cause gastritis, small bowel disease, large bowel, even the pancreas now. There's been some reports, the liver. So it can certainly affect the digestive system. One last thing I'll address is people have asked me, will there be long-term complications if I do get it in my intestinal system? And I do not know the answer. I don't know that anyone does, because it's still brand new. So we don't have enough long-term data to answer that question. I will say that the intestinal system is constantly replicating itself. So what I mean is the cells that line the intestine replace themselves quite frequently. So it's not easy to scar the intestines the way it might be to scar the lungs, for example. It is not easy. It takes a lot of inflammation over a long period of time to start causing scar tissue in the intestinal system. So this type of diarrhea, viral type diarrhea, where it doesn't invade deeply or cause a lot of damage, is unlikely to cause long-term scarring in the intestinal system. Now, one question is, could it lead to other things like irritable bowel syndrome one day? And we do know there's something called post-infectious IBS. Somewhere around 10% of people who get bacterial gastroenteritis may go on to develop a form of irritable bowel syndrome where they have chronic abdominal pain and discomfort, diarrhea, or constipation. But after viruses, it's generally less common in our experience to get irritable bowel syndrome. But what we don't know is whether literally just the stress and anxiety related to what's happening to all of us around the world could itself lead to a form of irritable bowel syndrome. There's some evidence that IBS is related to stress and anxiety. It does not mean that IBS occurs in your mind or that is a stress or psychological condition. It definitely affects the mind. It affects the body. We're learning more about IBS every day. It's a bit of a different discussion. I would only say that we need to keep an eye out for whether or not IBS might start to increase after this pandemic starts to fade, hopefully sooner than later. My research group is doing research on this. We, over a year ago, before all of this, did a study in 72,000 Americans to find out what is the background rate of irritable bowel syndrome, pain in the belly, diarrhea, and other GI symptoms. We're about to repeat that study here during the epidemic to see how high it's rising in self-reported symptoms. And our goal is to repeat this again in 3 months, 6 months, and optimally even a year from now to see how those symptoms may come down or if they stay elevated in the population. So we'll know more about that in the months and years to come. So again, if you have any questions, please always speak to your doctor. This is not considered direct medical advice. I'm sharing information, sharing research that I hope is useful to help think about this condition. And I wish you the best of health. Stay safe and be well.